Since 2019, or probably a little bit later, the need for mental health providers magnified significantly. There are a lot more children that are depressed and anxious, and children that had mental health problems are having more symptoms, and children that never had mental health problems now do. There simply is a lot more need now than there has ever been. So we've hired quite a few people in both nursing and social work, and doctors, nurse practitioners, physician assistants. We are a really rapidly growing division, and we're really proud of it. We have a great team, we have a lot of great people with great ideas, and we're really proud of what we've accomplished so far. It's important to understand that if parents are not doing well, the children are not doing well. And in fact, with every family that we're working with, we make sure we address that. If a parent is depressed and is really not so present in the child's lives, that affects kids tremendously. Even if parents think they're really not showing it in front of the children, children are so attuned to every minor problems that the parents could be experiencing that it's really important to deal with those. All of the parents, including myself, sometimes need some help in trying to figure out how to manage certain behaviors. There's nothing shameful or wrong about that. It's just we all do need a little bit of advice sometimes. So we are looking into expanding more into the community and doing more groups for parents and caregivers in general. Yeah, VTCC is certainly in the midst of the mental health crisis, just like the rest of the nation. We're working a lot harder, of course, but also we're redesigning our models of care altogether. For example, the way we treat children on the inpatient unit is changing rapidly. We need to make sure we provide more effective care to more children. And with the same amount of providers that we have now, the only way we can do it is if we're more efficient. We're looking into implementing new therapy models, new behavior systems, new treatments, and just the way we evaluate and treat children in general. Very often we forget that mental health is a huge component, and it affects so many areas of the child's lives. It affects relationships, it affects education, it affects physical health as well. We really have to be attuned to what the mental health needs are, both in children that have mental health problems and in those who don't. We really need to do a lot of work in preventing a lot of mental health concerns.